So, hello everyone. Welcome to this is my second live stream of the day, and it's sleep day for me. It's all about sleep. So, right now I am Cindy Rubin, and I am the owner and founder of In Touch Pediatrics and Lactation, which is a home visit practice outside Chicago. And I absolutely love being able to care for new moms and their babies. And I am I feel like one of the number one things that we address is sleep. And so I am thrilled to have Dr. Funke Brown on my episode today. She is let me see. So, general pediatrician and pediatric pulmonologist and sleep medicine doctor. Look at that. How does she do it? And she is here to help us kind of figure out how to sleep in this very, very challenging time of early motherhood and parenthood, and do it safely and efficiently, I'd say.
Yep.
So welcome, Dr. Funke.
Thanks for having me. Thank you so much, Dr. Rubin. I'm excited.
Absolutely. Me too. So, when we were preparing for this, we realized that there were a lot of things to uncover, and we probably won't be able to get to them all today. If anybody has any questions, please post comments. I will be peeking at that. And also, this will be housed on my YouTube channel, so everybody can go back and refer to it later if you need to, and please share with other people who could benefit from this. But let's start by talking about the challenges of being a new mom. So first, like, what are we struggling with? And I remember just being completely in a fog, I think, for those first couple of months after having my first baby. I mean, labor was long, so I started exhausted. There's my husband snoring on the couch while I'm in labor, and yeah, so you're starting with a deficit, and you have this newborn who you now have to care for, who wants to be on your chest constantly and needs to eat every 2 to 3 hours. And this is hard.
No, totally. I hear you. Mine's just like, it was just the first, I would say 2 months was just like a blur, right?
Yeah.
And I love what you said. Like, you're already starting off sleep deprived. First of all, the discomfort as pregnancy advances, as you're closer to delivery, the anxiety, am I ready? Is the house ready? Emotionally, mentally, physically, are we ready to have this new human being that's going to be dependent on me 24/7? So you're starting with that, and then there's the physical piece of labor, and then the baby comes, and it's like, yeah, they depend on you completely. So there's so many layers to why you may you'll be short on sleep. And I think that's, even from a place of kindness, people may say things like, you're never going to be able to sleep well again. You're, this, that, and the other. And so that doesn't help. So,
right.
it doesn't really help. So I totally hear you. There's on so many levels, the baby's feeding frequently and you're healing. Hormones are all over the place. So there's so many reasons why we're just not able to get enough rest.
Absolutely. Absolutely. So, okay. So we've established this is hard. So where do we start?
Yeah.
Not to put you on the spot or anything.
Exactly. You know what? I think even from the get-go, if hopefully, like you said, like with your audience, if you can share it with an expectant mom, I think that would be a great place to start. Like, you know what? This is coming, change is coming, so just kind of sharing this, because I think there's some things we can do even before the baby arrives. When we talk about things like where is the baby going to sleep? What's going to be the feeding situation? Am I going to be breastfeeding exclusively, which, of course, would be ideal, but is this a choice or versus not, which is okay as well? All those things play a role in terms of really being able to prioritize sleep. Who's my team? Who's my tribe? Because while I talk about, and that's why I don't just talk about sleep itself, but even rest. So having a state of quiescence, and that looks different for different people. Who are my go-to people that can watch the baby when the baby's sleeping, so I can take a walk, or I can just sit and just be. Those are conversations that you want to have even ahead of time, right? I mean, am I going to be pumping? All those kind of things are really important places to start, so that you're essentially, you already have that in place by the time the baby is here. So I think that's definitely a good place to start.
Oh, what a good point. I mean, I always think about, we get the crib and we get all of the baby gear and all the clothes and all but maybe at the baby shower we should be having people sign up to come over and take gifts.
I love it, like a sign up genius. Yes. I love it. Or meal prep. Meal prep, I think, is a phenomenal gift, because babies are growing so fast. I mean, of course, you could always use diapers, right? But maybe instead of that, maybe a gift card to like a food delivery, things like that help, because essentially you have 24 hours in what does not feel like 24 hours, right? By the time you go from once you feed the baby and you put them down and you change their diaper, you put them down, before you know it, it's time for the next feed. So how do we then sort of make sure that we're making the best use of the time that the baby is sleeping, such that we are getting the rest that we can?
Right. Yeah, I think it was also interesting seeing how COVID and being, sheltered at home played into that. I think there were positives and negatives. Maybe didn't have as many visitors to interrupt your sleep, but you also didn't have the visitors coming to help and just hold your baby if you wanted your baby to be held, or sleep over and take a night shift, or whatever it may be. So thankfully we're coming out of that time now and able to reach out to the people who love us. And I think that that's a really good point, to not be afraid to ask for help too. And we don't have to do this all on our own. I heard a really great idea, which was, have a piece of paper on your coffee table or wherever you kind of sit and feed your baby, and just keep a running list of all of the chores and things that need to be done. And when you have a visitor come over, they go to the list and they pick one and they do it, whether it's grocery shopping or make dinner tonight or do a load of laundry, whatever it is, because oftentimes guests come and they want to hold the baby, but you need to feed the baby, or they want to be entertained and you need to rest. So it's okay to advocate for yourself and get that time that you need.
Yeah. I love that. Gosh, I love that idea. It's like a running to-do list, because people do want to help, but sometimes they don't know how to. And as women, sometimes we're conditioned to not ask for help, so ask for help and make it easy for them to know how they can help you. So that's brilliant.
Right. And our partners want to help too. And sometimes it's hard for them to know what they can do, especially, because, but they're not, if you're breastfeeding, they feel like they can't feed the baby and they want you to pump and give a bottle, but that doesn't necessarily sound like fun to you. And the tip that I usually say is, you're in the middle of the night, your partner, when the baby starts to cry, your partner takes the baby, you keep resting. And again, it's that state of quiescence. You may not be sleeping, but you're resting still. And the partner can change the diaper, get the baby naked, hand the baby over to you. You breastfeed and immediately give that baby back to the partner, and they settle apart. baby down for sleep. And it may sound like, well, why do I want to wake up my partner for that? Like, I'm up anyway. I've heard that so much.
Mm.
But little things like that can make a huge difference in the end. And your partner will feel like they are helping, and they are.
Yeah, no, that is brilliant. And it adds up. It adds up the time,
Yes.
because you're changing by the time you're changing the diaper, all that stuff adds. Imagine doing that twice over the course of the night, or whatever, or 3 times. It adds up such that
Yes.
eventually all these things accumulate. And I love that. I feel like it helps you in terms of just buying back a little bit of time, and it helps your partner feel like they're engaging in that process as well.
Right. Right.
Mm-hmm.
Right.
Mm-hmm.
So let's talk a little bit about what additional things besides just babies needing to feed
Yeah.
frequently lead to these challenges. So there's a lot of recommendations out there for how to do this right, right?
Mm.
And some are some make sense and are manageable, and some may be very, very difficult or next to impossible for us to achieve. And I think a lot of parents want to make sure that they're doing everything right.
Mm.
And, one very important thing that we hear about a lot is back to sleep and SIDS, sudden infant death syndrome. And I think all of us, especially as physicians and pediatricians and sleep doctors, want to really, really discuss this a lot with our patients to make sure that their baby is in a safe spot for sleep. But that can be a challenge, right?
Yeah, yeah, absolutely. Mm-hmm.
Yeah. And the AP kind of extended these recommendations a few years ago and recommended room sharing, as well as not bed sharing, but room sharing for the entire first year, 6 months ideally, but if you can, for the entire first year. This recommendation was not out when I had my babies, and I'm kind of thankful, because I think I would have I would have really tried to do that.
Mm.
And it may work for many people, but babies are loud.
Mm-hmm.
And so that really gets in the way. And so for
Mm-hmm.
people who are struggling to be like the right kind of parent and do everything by the rules, what kind of advice do you give them in these sorts of situations?
Yeah, no, that is so true. I honestly, I would have bunked it as well. And of course, as an expert in the field, I want to role model, right? I want to follow the guidelines as appropriately as possible. But one of the things I always remind parents is that these are recommendations. They're not rules, right? They're guidelines with, of course, evidence behind the thought
Sure.
process, but they are guidelines. So you have to take this information, and then you take it back to your family and your values, and what are the things that are important for you. So if you think every moment the baby turns, you're awake, alert, you're like, what's going on, and that's something that's going to be disrupting your sleep, then maybe a whole year of having them in the room may not necessarily be what would work for your family. You know what I mean? So I think that's something that we have to bear in mind, because what then this creates, especially for a new mom, you like the baby comes out, and sometimes we're already like, oh my God, this baby came out and I've already failed the baby. We already come we come with so much guilt, and we're not doing it right, and it has to be done a certain way. I promise you, babies they're not going to be sitting on a therapy couch because you put the diaper on backwards. You know what I mean? Like, they don't. No.
They might be a
They,
little wet.
I know, exactly. They may be well, but if you don't tell them, they will. You know what I mean? Like, no. So just free yourself from that need to be at a certain standard. Find what works for you and stay with it, because honestly, it's making sure the baby is loved, the baby is nourished, the baby is safe, and what you need to encourage that is what matters. So when it comes to of course room sharing, I think it helps with just the ease when it comes to breastfeeding. Again, room sharing is what I would advocate for. The ABCs of sleep is that a baby should be alone in on their backs in the crib or bassinet, you know, and I think that keeps the baby safe. As they start to get older, if you feel that having them in the same room is extremely disruptive for your sleep, then I think at that point it's time to have that conversation to say, okay, I think we can move the baby now to their own room, and that's fine.
Yeah. Yeah. I know I remember finding like the exact level of the monitor where I couldn't hear the grunting and groaning of the baby, but I could hear the crying.
Perfect. Perfect. And I
So,
think the white, we, and then, we may talk about this later, but there are ways you also want to set up your child's sleep environment.
okay, let's go over that.
So yeah. So, in addition to what we talked about, when you're setting up the crib, the safety is really important. You don't want all the like plush, cute animals there. You don't want all the bumpers, all that. You want that crib as flat, solid, surface,
Mhm.
and things like that, just for safety, so they can't roll over or get caught in the side or anything like that. So I think that's very important. Then we
Mhm.
start to talk about things like lights and how light can interfere with sleep. So we're talking now about a mom who is just really sleep deprived and exhausted. How can we buy back time? We talked about engaging your spouse, maybe to do some of those like initial things whereby you're just really nursing the baby during that nighttime feed. That will give you time. Another thing is to try to elongate the time when the baby is sleeping as much as possible, and you can optimize the environment to do that. So making sure that the room is as dark as possible. That's really important because they start to perceive light, and our brains start to register that light, is supposed to be during the day and darkness is at night. So you're starting to sort of train them now to when we talk about the light and day and our circadian rhythms within the first 3 months of life. Babies really don't have a set circadian rhythm yet. Our brains produce a hormone called melatonin, which is sort of a sleep hormone, but that doesn't start to consistently get produced until about that 3 months or so, which is why we don't
Okay.
recommend trying to sleep train a baby, because
Mhm.
night and day is all over the place for them. But even just the environmental cues can start to get them ready to realize, okay, when it's bright, then it's daytime. When it's dark, it's night. So you want to try to keep the room as dark as possible at night. You want to keep the temperature cool, I mean, comfortably, not cold, of course. And definitely you don't want them overheating, because when they're too hot, then they're more likely to have more restless sleep, and they're more likely to wake up. And then one of the other things I encourage paying attention to is just the noise. So most babies, think about it, the womb is a very noisy place. So one of the things that really helps is finding ways to mask noise when your baby is sleeping. So a white noise machine, I think, is a great investment. It helps for you as the mom so that the little peeps they're making, you don't hear it.
Yep.
And then when you need to go to the bathroom and flush, they don't hear it because that white noise machine is going. So it's very good. It kind of masks that outside noise in that sense. So those are ways that you can sort of get more bang for your buck in that sense in getting time. And then something else that I usually would recommend too is prioritizing their daytime feeds as much as possible. So
Mm,
trying to get as many of those feeds in during the
right.
day, so that at night, if they wake, maybe once or twice, versus them spending the bulk of their nights trying to catch up on feeding.
Yeah, that makes sense. I One of my colleagues used to recommend like for babies. So babies will often when in those first few months do something called cluster feeding,
Yeah.
whereas in the evenings they tend to just want to eat very, very frequently, maybe shorter meals, but very frequently. And sometimes that's like, between 5 and 10, but sometimes it's like between 10 and 3. And, for those babies that tend to do it later, some parents have successfully kind of almost forced cluster feeding earlier to do
Mm,
exactly what you're saying, kind of fill them up, bulk them up
yeah.
so that
Yeah.
maybe then they will start to take longer stretches at night.
Oh, I love that.
Yeah.
That's brilliant.
It's worth a try. It may not
It
work for
is. It
every
is.
baby.
It is. And you know,
Yeah.
the other piece I'm gonna say, sometimes babies are, you know, maybe if they're falling asleep on the breast, if you're like during the day, and then at night they're hungry. So really making sure they're as full, they're actually full, and not just like you're not just feeding them to take the edge off during the day. You're making sure they are full. So, you know,
Right.
you start to look at those cues when they're hungry, really paying attention, because when they're full, they're a bit more relaxed versus them just falling asleep. So you want them fully awake during a feed during the day. You want the lights to be on, strip them naked, make it like like someone said, like National Geographic. Everybody's naked. If the lights are on, you know, tickle them, whatever. Just get them eating as much as possible during the
Right.
day,
Right.
so that way you're sure that you're really building up that you're really filling that tank up as much as possible.
Yeah. Yeah. And what about like moms who just think, okay, my baby is waking up every 2 to 3 hours at night, but I need 6 hours. Like I cannot function if I don't get 6 hours of sleep. But I'm breastfeeding. What do I do? I mean,
Yeah.
is there a solution?
No, that's a very valid point. Now, when you think about it, if you sort of done more of those basic things, you've set up the environment to promote as much sleep. And one of the things I want you to be aware of when we hear about babies waking up, are they really waking up? Many times, what I've noticed,
Yes.
okay, babies, especially newborns, are going through just 2 stages of sleep. When they are older, then we go through what we call 4 stages of sleep, right? So babies have what you call quiet sleep, right? Which is when, and you'll notice it. You'll notice your baby sometimes. It's like you're just like, are they breathing? They're so quiet. And then
Yes.
they have what you call active sleep, which is the alternate for REM sleep that we have as we get older. And so their REM sleep is sort of more active sleep. So their heart rate is up, they're active, they're grunting, they're moving, they're smiling, that is what you call active sleep. Now, what I notice a lot of times is that moms see that and they're like, oh, he's about to wake up. Let me feed him. And so
Right.
sometimes I recommend just taking a pause, because sometimes when babies are cycling through their sleep cycles, which are short, about 45 minutes or so initially, it may be that they may have this brief arousal. They may even cry out or something. Give it a moment, because they may just not be waking up. And even if they wake up, they may not be hungry, especially if you've really done as much as you can to make sure they're fully fed um, during the day. So just
Yeah.
really, I would say, be aware of that. I know that we're on high alert as new moms. So you're like, oh, he's hungry, now to the rescue. Sometimes they're not. And sometimes they may not necessarily be waking up. So we may end up being the ones fully now waking them up. They take a few sucks at the breast, and then they pass out again because they weren't necessarily
Right.
in need of a feed. That's something we have to be able to tease out as
Yeah.
something. Another thing I would recommend, especially, is as the baby is getting older, is an introduction, a concept of what we call like dream feed. And I'm sure you
Mhm.
you offer that as well, or tactical feeding. So it's almost like especially when you are ready to go to bed, you can literally gently, not fully wake your baby, just feed them enough to again extend the time they sleep until their next feed. So this way,
Yeah.
they're actually really full. So these are some. So go through that list. Look at the environment. Is it noise? What's going on? Are they really waking up? Are they hungry? Can I introduce a dream feed at some point? I think those are just some strategies that I think will help.
Yeah, I think that's great. Those are wonderful ideas. In addition, I always, we're human and we may want to exclusively breastfeed, but then we
Yeah.
realize that we need our 6 hour stretch of sleep or we are not going to be a good parent or a good person.
Yeah.
And so, yes, your supply may be affected
Mm,
by sleeping through that period of
mm,
time, but maybe it's worth it in your situation for
yeah.
your own mental health and
Yeah.
sanity. There's no amount of breast milk that is worth
Being on breast.
sacrificing your own health.
Yeah, I love that. That is so important. That is so empowering too. Because yeah, we hear all these things like, yeah, just push through and you must, but at what cost? At what's the
Right.
cost, right? So if you need that time, another thing is you can pump and have your spouse give the bottle, right? Like, or
Mm.
something of that. So that's one. And at the end of the day, if you think about it, if you are sleep deprived and so exhausted, that will affect your milk supply. So
Right.
then there's no point to it. So if you do need to give yourself that like grace that it does not have to be this way. If it doesn't work for me, that is okay.
Yeah. Yeah. Oh, it's so hard. It really is. Well,
Yeah.
and that was so interesting hearing about the sleep cycles of the babies and that they're different. So I don't know about you, but I actually have this in another video, a recording of my daughter grunting in the middle of the night. And I play this for parents because I am convinced that they're not grunting in pain. And this gets interpreted, I think, quite frequently as
Mhm.
pain, gas,
Mhm.
heartburn, hunger, whatever it may be, usually tummy things.
Mhm.
And I really think it is part of a neurological phase that babies are going through just over time. Parents will tell me this, and I'll say, well, are they actually awake or are they sleeping? And they're fine. And they're like, oh yeah, they're not really, their eyes are closed,
Yeah.
but they're grunting and grunting and grunting. And
Mhm.
I, out of just time and experience and seeing more and more of this and experiencing it myself, I think that it's probably these times when they're getting a little bit more active, and some babies during that time, they grunt.
Yeah, they do funny things. They do funny
Yeah.
things.
Yeah.
Yeah. Yeah.
And so again, finding a way to be able to sleep through that. It's interesting. I've heard that a new mother, her senses are like a soldier at war. So you will wake up because you're
Mhm.
programmed to. That's
Mhm.
survival, right? Your
Yeah.
baby needs you to wake up if they need you. But
Mhm.
unfortunately, it means that we wake up when they don't necessarily need us to.
Mhm.
And so
Yeah.
sometimes we're going to guess wrong and probably err on the side of checking just to make
Yeah.
sure your baby's okay if it sounds like something's not right.
Yeah.
But sometimes we have to let our little babies figure
Be
it out.
babies. Yeah, yeah.
Ooh,
I think, there are definitely times when you would know, maybe it's time for me to, call my doctor, send them a video, if you're
absolutely.
noticing things where, with all this, the baby is having difficulties with growth or difficulties with feeding or having issues when they're weak, where they're also breathing in a very disturbing way, or
Yeah.
their ribs are sinking in, and it's not just like certain times or things like that, or anything else that's concerning, then of course you would want to bring it up with, because there are some, even babies this young can have things like sleep apnea, where
Mhm.
they may have actual pauses in their breathing, but it's not just, usually you'll see it accompanied with something else. It's usually not just this intermittent grunting we'll see. It may be like snoring, it may be like actual, long pauses. It may be, usually there's more things that are going on. It may be growth. Growth is something that I see that's affected a lot of times in babies that have those kind of issues. So it has to be in context of
Mhm.
everything else that's going on.
Mhm. Yeah. Yeah. That's great. So actually, so this brings up an interesting question, which is sleep training. So you mentioned that a little bit earlier. There are lots of different ways to sleep train and lots of different. An emotional topic, I think, for a lot of people. But I do have parents who come with babies who are 2 months and ask me how to sleep train them. And so, what do you think are what are the guidelines that you
Yeah.
usually use around sleep training?
Yeah, and I think sometimes, yes, you're right. It's a very emotional topic, because every time people hear sleep training, right away what they hear is, I put my baby in bed and I just walk out the door while this
Leave
baby
them.
is desperately crying for help. Like
Right.
I'm just this brutal, wicked mom, and that is completely wrong. And so maybe a way we can coin it instead is helping them learn how to sleep independently, or sleep learning, like, or sleep school. I don't know, you know what I mean? So it's not like this like combat kind of situation,
Right, right.
because like you said,
Sleep
there's
workshop.
sleep workshop. There we go. Sleep workshop for your baby. I love it. Because there's so many ways. And that's what I say. There are no perfect ways to sleep train a child. It's the way that works for you. And really, I think this is a skill. The same way if our baby, and they may protest because they've been so used to, especially within those first 3 months, they're so used to you being there and falling asleep while you're feeding them, and you really, tending to every one of their cries and things. And now you're trying to help them like do this on their own. It's a skill. They'll protest. That's all it is. It's a
Right,
protest. It's not that they will, because why would we want to do anything hard? I mean, and it
right.
doesn't even have to be hard. So, so just see it that way. And there's so many different ways to do this. Either you want to, if all you want to do is just start to establish a routine for your baby, or start to separate feeding from sleep so that they know that there's feeding. Feeding is a process that I engage in when I'm awake, and sleeping is sleep. And so if that's what we're trying to do, I think you can start to do that. One thing I would recommend, no, though, is before the baby is 4 months, honestly, I really don't recommend trying to sleep train or promote independent sleep, because they're not at that point where developmentally they have any sense of like object permanence. Mom is not there. They just don't know. That's one.
Yeah.
And two, like we talked about the melatonin production
Mhm.
and the ability to fully discern between day and night based on their circadian rhythm, that doesn't really kick in, or it doesn't become fully established until they're at least 3 months. So I just think right now, enjoy your baby, give them what they need. If you're feeding them and they're falling asleep on the breast, well, it's okay. As they get older, then, as they get to that 4 to 6 months, as long as they're gaining weight, okay, as long as the pediatrician gives you the okay, you could start to teach them to sort of fall asleep on their own. And this will look different for different people. Most of the
Mhm.
time, what I say people should start with is try to avoid them completely falling asleep before you put them down. So that's always a good place to start. And then the rest, you sort of start to build from there.
Yeah, yeah, that makes a lot of sense. And if feeding your baby to sleep and is working for you and your baby, then it's not something that you need to change either.
Exactly.
So
Exactly. Because
yeah,
I
I mean,
had, you know what? Some babies come and you feed them to sleep. The last thing they remember was being nursed to sleep, and they still sleep through the night. Or
right.
they wake up a couple of times and it doesn't take much from you to feed them and put them. That is okay. That is okay,
Right.
I think it's when it gets to the point where you also are struggling as a mom because you're
Yes.
constantly waking and you feel like there's a need to, make some changes, then a conversation can be had. But this
Yeah.
is not a rule or anything at all. It's really doing what works for you and your family. So absolutely.
Yeah, yeah. I'm gonna give away one of my favorite things to tell parents, which is, so I'm a type A personality and I wanted to do everything by the book. And I did do, I used the Ferber method for sleep training my kiddos. And I do really like that method. It worked for us. But I remember one night when this was my first baby, and he was crying way longer. Like he had been sleeping okay and now was just crying way longer than usual. And I was, I'm like, do I go? Do I go? Do I not go? And my husband went, and I was thinking, oh, you're reversing everything we've been doing for the last week. And and he said, Cindy, sometimes you just have to put down the book and be a parent.
Hmm.
And it was such a
Hmm.
wise thing
Hmm.
for him to say. And it made me
Hmm.
realize, I mean, that was very early parenthood for
Hmm.
me. And I appreciate parents so much more now that I've been one.
Yeah.
It's
No.
not easy. And sometimes you're going to do things that end up working and sometimes they won't, and you have to go with your gut feeling. And like you said earlier, you also have to give yourself grace
Yeah.
when maybe you realize, oh, I could have done that a little bit differently. We're not perfect,
Nope.
and we learn. My son just had to answer a question of what do we get from history? Like, why do we learn history? And it's so that we can learn from our mistakes and
Mm.
do better the next time.
Yeah, yeah, I love it. And you know, and we have seasons in our lives. It may just be a time where no, everybody needs to just be and get through. So we're not putting this already. Parenting is already a hard thing, right?
Yeah.
And so adding more on your plate, if that's what you feel like sleep training is, it may just not be the time. You know what I
Right.
mean? And that's okay. And whenever you feel like, okay, I'm ready to do it. I don't like that my baby wakes up every time and needs me to put them back to sleep. And then you'll do it. You know, and if
Yeah.
you go through a season when the baby is not or is sick or you're sick, and everybody, you just need to do whatever it takes to get everybody as much sleep as possible for that season. And then if you feel you're ready again, you'll get on with it, and that's okay.
Yeah. Yeah.
Mm.
This is great. This is a great way to go into the weekend.
Mm.
I just feel like I can do anything. And, there's hope for all of these
Yeah,
situations. And they are
yeah,
seasons,
yeah,
like those
yeah.
first few months, there's
Hmm.
probably very little. If you happen to be lucky and have that baby that starts sleeping 10 hours at a month, more
Good
power
for
to
you.
you, but it
Yeah,
will change. It
yeah,
will get better. Babies
yeah.
will start sleeping longer,
Mm.
maybe at 4 months, it may be at 9 months, it may be at 2
Mm.
years, but
Mm.
it will get better and change. And there are
Yeah,
people you can reach out to for help if you need it.
absolutely,
Yeah.
absolutely.
So, on that note, where can we find you if we need your help, and what kind of services can you provide?
Yeah, absolutely. This has been such a fun, just a great conversation, and I really hope it's provided value. There are different ways to reach me. I'm on Instagram, so come hang out with me there as Restful Sleep MD. I have a website that's restfulsleepmd.com, and there's a blog there, and there's also the way to actually connect with me. I have a coaching program for moms, um, new moms, high performing moms, who are busy and sleep just does not seem to fit on that plate. Moms looking to help their babies be independent sleepers, all that. So you can connect with me there. And I was also fortunate to create a sleep course with Baby Center. And I'm sure many people will know Baby Center. So we have a
Hmm.
course that takes you through different evidence based strategies to help your baby fall asleep independently. And we talk about things right from when they come in home, right from even before they're born, how to really start to set things up for good sleep success, all the way to when they're a year old. So I think that's a great resource, and it's on babycenter.com/courses. So that's also a great way to really get some information, and also decide on, okay, this is the method I'm going to choose if I decide I want to choose a sleep training method, or no, I want to try something else. So that's also somewhere you can get to see me.
Okay, great. Thank you. And I will definitely, as I said, I'm going to house this video on my YouTube channel, and I will put links to find Dr. Do people call you Dr. Funke professionally, or more Dr. Brown?
I think Dr. Brown is my street name, but then people do
Yeah.
call me Dr. Funke too.
I like it.
Yeah.
So I will put all of the links and ways to reach her, and I am quite certain that we'll see her again here. I'm
Yeah.
thinking we need to have a session about toddlers.
Ooh, yeah, let's do it. Mm-hmm.
Yeah.
Yeah.
All right.
Yeah.
Well, I wish all of our listeners a wonderful day and weekend. And thank you so much, Dr. Brown, for joining me and all of your wisdom. And I'll see you later.
All right. Thanks for having me. Good to see you
All right.
all. Take care.
Thank you.
Bye.
Bye-bye.